Hi, my name is Pat Ritsinas. I've been with Reena for about 18 years. I'm an SDSP out of Stonedean and Rockview, and I'm part of the COVID-19 task force. And if you have any questions or concerns, feel free to send me an email. You can find me on the Reena mailing list. And I'd like to introduce Mahen, who is also an SDSP at Whitaker, and he
And
is one of
437 Wilson.
Thank you, Mahen. And also, he is one of the first Reena staff to have gotten the COVID-19 vaccine. He got his first one last week. Is that correct?
Yes.
And he'll talk a bit about his experience. So welcome, Mahen. And oh, and Sharon is is from head office, and he is our marketing guru who puts
That's
all the videos together.
Thank you very much. Pleasure to be here. Thank you.
Okay, Mahen, tell us a bit about yourself.
My name is Mahen, and I am with Reena several years, I think since 2003 or 4, maybe. And I worked at Ruden first and Gardale, and then I was transferred to, I got the SDSP position and I came to 17 Whitaker, and my locations are 17 Whitaker and 437 Wilson, right, presently.
That's good. So tell us about your experience. How did you, where and how did you get your first COVID vaccine?
I was waiting for an opportunity to get this vaccine because of I am getting involved with the individuals who are vulnerable. Plus, I have a family, which is my mom and uncle. They are over 80s. So I just wanted to make sure everybody is protected, as well as I think I don't have any doubts about the vaccine. So I just called actually the public health, because one of my friend's wife is working in Burlington Hospital. She said that they are giving for frontline workers.
Okay.
So I called them, and I called the health, the public health, and I got registered. And then they said come, so I went, and then I got, only thing, they didn't recognize Reena first, and then I had to show all my IDs and letters and everything, and then they said, okay, because you are from Toronto, doesn't matter, we are just putting as Toronto. And then they gave me, and then they said, we are putting under you as long-term care. That's the way they put it.
Okay.
So,
well, you never know. Reena could go to Burlington soon.
yeah, that's what I said. Like, I was a little bit shocked that they didn't know, but who, doesn't matter for me. I had to provide, which makes sure that now they will be knowing Reena.
Indeed. So how did you feel after you got your first shot?
Little bit when I got the shot, because first they will ask you all your health questions. So you have to let them know, because I have diabetic.
Okay.
So I told that I'm diabetic.
Okay.
And then they asked me whether I'm taking any medication or whatever it is. I said yes. Other than that, they asked me other these things, which is any health related things. And then I said I don't have other things. So they said they asked me whether I'm having any allergies or allergic reaction for the vaccines. So I said no. And then they gave me the vaccine, and then they were good, and then they said to wait for 15 minutes. So I was waiting for 15 minutes, and then they have put a big sign that what are the reactions you will get it.
Okay.
So there is nothing, I didn't get it. And then they said to me, okay, after 15 minutes I went to, when I'm exiting, there are people sitting, and then they will give you the next appointment right away.
So you already have an appointment for your second shot?
Yes, January 30th I'll be going.
Okay, so how long has it been since you've had your first shot? When did you get your first?
I got it on, I think now almost 1 week, I think 1 week to, yeah, 1 week. Because
And
after
no,
3 weeks only, you will get the third, the vaccine, the
so
second
no,
vaccine.
okay, so now you've had it for a week, no side effects, no discomfort, you haven't had any health issues?
No, nothing. I am, I feel good. I think people should get it because lot of, you know, things are going on WhatsApp and other things and all those things. I think you shouldn't follow those things. You have to have the faith and then you should go. That's it.
So you have no problems telling your coworkers at Whitaker or at Wilson that they should go get the COVID shot. There's no issue with it.
Yeah, I already told, but like, it's up to them. But I have already told because they are seeing me every
Hmm.
day how I'm doing things. I didn't change anything. I'm really, to tell you the truth, I'm doing more well.
That's good. Well, because it's in your mind now that you've got this vaccine and you're getting.
Yeah,
And when's your second shot?
yeah. Yes, one thing is that, but like that doesn't mean that like, we are free from COVID because we have to follow the protocols still.
Still,
That's
Absolutely.
what I said to them. Like, it doesn't mean I got the vaccine. Like, I'm not wearing the mask. I'm not wearing the thing. We have to still follow all the codes and then protocols, no matter what. Like, even when I go home, I do the same thing. With the moment I go, and then I will just say hi, little bit, sit down, and then with my family, with my mom and all those things, and then I will go inside. After that, I won't come out. That's the way I do always.
That's good. So when's your second shot?
Second shot is on January 30th.
That's good. All right. And so far so good, as you said.
Yeah.
So what? Yeah. So what message would you give to the arena staff to encourage them to take the vaccine?
I think they should get it because they should know that we are helping the people who are vulnerable,
Hmm.
as well as we also shouldn't take anything anywhere to our own families also. That's
Hmm.
what I think because we have to be safe and then we have to make sure that like, we are good to go out because the way I see, like, if I am saying, oh, it's not good, don't take it or whatever it is, what about the doctors and the nurses? If they say, then where we will be standing.
Hmm.
You
Right.
understand? So
That's good.
that's what I think because we should get it actually because like people are saying different things, but I don't think that way because for me, I don't know. For me, this is me. I always think the positive side and move forward. That's the way I do things.
That's good. That's
And the
good.
solution is in you.
Hmm.
That's it.
Absolutely. Thank you, Maheen. Thank you for sharing your story and thank you for
Oh,
being so positive about the vaccine.